Most of you know Carlos from Montefiore, and he's going to talk today about metabolic syndrome, a very important thing that most people don't know much about.
Yeah. Thank you, Matthew. Again, Carlos Tejeda from the OCPA, Community and Population Health Department here at Montefiore. We are an institution over here who have about 7 different hospitals within the Bronx. And the one that is the more common people is that the people know is Montefiore Moses Division on Gone Hill and Baychester. Bainbridge Avenue is the main hospital. And we had Albert Einstein, which is a teaching hospital. We are teaching hospital, but Albert Einstein hold the Albert Einstein's medical school or medical college, where we have the advantage of have 250 new students every year who want to become doctors. So after 4 years, we had those doctors available for our community. Uh, but metabolic syndrome, an interesting topic, and that we do not hear doctor talking to us much. Uh, we can pass to the next slide, Matthew.
Hopefully I can get this to work. Oh, there we go. Okay.
This is what we want to know about metabolic syndrome. Metabolic syndrome, exactly why I had to worry about metabolic syndrome, why metabolic syndrome mattered to me, what are the risk factors for me to think or to even consider that to be a thing in my life from now on. And we're going to be talking a little bit about signs and symptoms and diagnosis, and also we're going to be talking a little bit about prevention and treatment. Matt, the next one, Matthew. And yes, about metabolic syndrome. Metabolic syndrome is a condition that include a group of more than one medical problem that end up or can put us at risk factor of developing problem within our circulatory system of basically having cardiovascular disease. And what is a cardiovascular disease? Any condition that any medical condition that will put us in the risk factor of cardiovascular diseases, like having a heart attack, like having problem with the veins around my heart, blockage, and that going to put me to have a weak heart. My heart is not, let's say, pumping the right amount of blood to my body in order for me to get oxygen, nutrients, and minerals. So any included or any group of medical conditions that will put me in that way. When when you as a patient have one or more condition, is when in the future then you end up in the window of developing cardiovascular diseases, and excluded of medical condition that might include, for example, and when we think about this metabolic syndrome, what can put me? I have a little abdominal fat in my end. I have hypertension in my end. Um, I have impaired glucose or hypoglycemia. I am developing diabetes. So right there, I have mentioning three significant factors that sometimes us as a patient don't pay much attention, just to the point of, oh, I have obesity, and I'm the owner of, let's say, a little bit of belly that has a lot of fat. I'm developing, or I have been suffering from hypertension for quite some time. I might have high triglyceride level, meaning bad cholesterol, and I'm doctor put me on medication. But now, this medical condition, the owner of a big belly with a lot of fat, me, I had hypertension, me, I had developing cholesterol, me, I am in the process or in the work or in the path of developing diabetes, me, then with those 3 or 4 factors I have mentioning, when you have more than three, that is what we the medical science calling as metabolic syndrome, meaning that you have more than one condition that in the end hypertension, diabetes, or obesity, or high cholesterol going to put me in the path of developing cardiovascular disease. Now in front of me as a group, the community, or me in the path where I'm going to be walking straight, but in front of me there will be different paths in which I had to move because of my medical conditions, and the conditions now um, I would have instead of just thinking about one, now I had different medical conditions that I had to take care at the same time. And what we do sometimes is that we pay more attention to one and not to the other. Or maybe we pay attention to two and not to the other three. Because always when we have one medical condition, always it can in the path of developing more or something else along the path. And when we do not look straight in front of us and we are carefully measuring or how measuring exactly how I made my decision about my medical condition, I end up not putting much attention and not developing others. Matthew? Um, and for example, what is metabolic syndrome? Metabolic syndrome, again, is a serious health condition that if we put, for example, if you put 100 people in one room, 27%, 23% of that group of, in another word, if I have 100 people in one room, 23 of the people in that room will be exposed or are in the path of developing more than 2 or 3 medical conditions. That is, for example, 23% of the population of the United States in any given moment are exposed to more than 2 or 3 medical conditions. It means that is a serious problem in our society, in our community. Uh, the underlying cause of this syndrome is basically um, the risk factor that I mentioned before, being overweight or obesity, having lack of physical activity, which is another type of disease that we might consider to be a risk factor, because it's a risk factor. At the same time, it's a condition that we can change by just making one decision, especially when we're talking about physical activity or inactivity. And the genetic risk factors are those um, medical problems or diseases that we inherited from our parent. What do I inheriting from my father? My hypertension, my diabetes, sometimes my obesity. It's in the family. Uh, and for example, those two conditions, hypertension and diabetes, usually they come hand in hand. You might have diabetes, but not hypertension. But if you are a person that, let's say, do not put or not pay too much attention about your glucose level, you might end up developing also um, hypertension. And that is why I'm saying that you're working as a patient, you're working a line. But as a community, also, we're working a line because whatever we see, wherever we look, we see every factor. You might know 3 people in the community, maybe one and a half of that group that you know one is obese and the other one is on the way of getting obese. If you know 10 people, uh, 2.5 people of those 10 people might be a risk factor or maybe higher, depending on uh, the community and depending also um, the physical aspect of how the community is evolved. If you are in an African American community, you're going to be seeing a lot of people that are obese. If you are in an African American community mixed with Latino, you're going to see also a lot of people with more than one condition. Why? Because usually uh, the mere thing of being from the African descendant or African American race or the Latino or Hispanic population race, also we have a tendency as a risk factor because our race to be in the high end of developing those diseases. For example, high blood pressure, along with a serious condition, but not very well, I would say, managed by us. Um, Also, the fatting of glucose level that we're going to be seeing. And for example, you see over here the picture on the left that has some blood vessel inside, and you see the very tiny yellowish dot within that blood vessel that is kind of in the shoulder in the picture of the left. The picture at the center that say A1C are the glucose level on a person that, for example, um, you see there success is mean that it's in good hand when you are less than 6.5 in your fasting glucose level. But if you are in the yellowish par or you are in the red, then you are in danger. And we're going to be discussing a little bit more about now the picture of the right, exactly what we see all the time in our community. The little belly, that belly with that fat right there at the bottom of my belly button, that fat is a problem in our community. Oh, yes, a lot of people are being proud and they are proud of the big belly, but in the end, the big belly become a problem, and that problem become a risk factor for us to developing diabetes. Next one, Matthew. Uh, in here, metabolic syndrome and how it's happening and when it happened. Again, we mentioning over here three or more conditions. And over here, we're going to be discussing about a little bit why my belly, abdominal obesity. If you are a person that if you go to the store and you need to buy a pen and that pen is more than 40, that is a risk factor. But if you are a woman and at the waist, your pants for men are your belly, for men over here at your belly, if you are 40, it's a risk factor. For women, it's 35, it's a risk factor. Why? Because obviously, when you own that that number in your weight, it means that you are overweight. It means that you probably have more than 30 or 40 pounds above what your normal weight would be. And for example, a person of my height, I am 5'9". Um, that is my height, 5'9". Now, my ideal weight is 165 to 170. A lot of people complain, but you're going to be looking very skinny. Yes, but I'm going to be in my right way or around my ideal way in my body. I will be using my ideal number at my weight. I will be able to do more and to feel more and control more my outcomes in my medical problem. If I, let's say, have hypertension, if I have diabetes, I will be, because I will be probably doing a lot of physical activity and I will be able to control better those numbers. So remember, if your weight is more than 40, a risk factor for metabolic syndrome as a man, and at women, 35. Triglyceride level, meaning that normal will be less than 150. That will be your triglyceride, and that is something that the doctor always check on you. or let me see your triglyceride level. And always, every time you do blood work at your doctor, usually at least once a year they check it. But if you have some medical condition, at least twice a year, or maybe um, more frequently, you will be checked by your doctor, because those numbers usually are the parameters that they use in how medication and treatment is going to be affecting your life, meaning that maybe decrease or increase depending on the screening and the results that you presented to your doctor, that your body will present it to your doctor. Um, when we're talking about HDA, bad, bad cholesterol or good cholesterol should be less than 40. But when you are more than 50, then for women more than 50 or for men more than 40, obviously you are developing problem within your glucose level. Mean glucose level and probably within your vein, no glucose level, I'm sorry, you're going to be developing problem within your vein, probably too much fatty um, fatty fat inside your vein. And when we have a lot of fatty fat inside my blood vessel, what happens is very simple. Sometimes we end up developing blockage, which we're going to be seeing further up. And when we're talking about hypertension, this is the way it's diagnosed. This is the way metabolic syndrome is affecting your body. For example, your blood pressure easily. If you see this chart that we have here in different color, usually you will see that the idea for blood pressure, it doesn't matter. Let's say if I have uh, sometimes people believe, or they believe it as if I have um, a high body, if I am overweight, yes, your body might going to be affected, or your blood pressure will be more likely affected. But in some cases, people go to the doctor and the blood pressure is always good. But that doesn't mean that the body weight that you have will be normal. Yeah, your blood pressure is normal, but the body weight in your body is going to be a fat for other medical conditions. But the idea on your hypertension is 120 over 80. And it doesn't matter if on your way, but if you have a normal blood pressure, that would be your number. Now, way back, maybe 5, maybe 7, maybe 10 years ago, doctor used to talk about prehypertension. Doctor do not talk about prehypertension anymore. It's a simple fact that doctor find out through study at school that when they was talking in the past about prehypertension for patients, uh, prehypertension means that usually patients end up developing problem along the way as they didn't treat it, that prehypertension. So about maybe as I say, I think it's close to 10 years ago when doctors stopped talking about prehypertension and they began now to say, oh no, we have elevated blood pressure every time that you are around 120 to 129 and your number is it could be the bottom part could be less than 80 or around 80 or plus 80. But if you are all the time 120 to 129 every time you check it, it's time for us to make decision, to make lifestyle changes that we're going to see further up. Your blood pressure is 130 to 139 and more than in between 80 to 89, obviously you will be in medication with your doctor right away. Some type of therapy the doctor will be recommending to you. And hypertension about 140 or more, with number about 90, obviously for you to think about calling your doctor and find out if the medication is working or not working, if you need to add a medication, if you need to decrease a medication, but something the doctor will be talking to you or telling you with number that high. Now, critical hypertension is when your number is more than 180. Sometimes we're developing a headache. Sometimes we're developing a blurry vision. Sometimes we're developing a pinning head where you're feeling that you are not in your mood, that you're not, that everything around you is like kind of weird and things are moving. And when you move your head around, you see things moving around you and you kind of dizziness. With hypertension and symptoms like that, it's not for us to think about going visit the doctor the next day. It's a thing for us to think about calling the ambulance because maybe your body is telling you something. Your body is telling you that you are developing probably a dangerous condition that had to be addressed by a physician or a teen doctor right away. So sometimes the essence is to call the doctor. When you see high blood pressure around those levels, if you have a machine and it happened that you check it twice, and if you need to check it 3 times, check it 2 times. But the idea is to call the ambulance, not to go to my car, turn on my car, and oh, let me drive myself to the emergency room. No, the thing is to call the ambulance because the ambulance is something serious is happening in your body. The ambulance had the right medication uh, to try to start uh, treating you right away. So keep that in mind. Matthew. And when we're talking about diabetes, it's another factor for all. And again, I mentioning earlier when you're developing one problem, specifically if you had hypertension, more likely you're going to end up developing diabetes as well. If we are African Americans, if we are Latinos, if we are from the Pacific Islands, if we are Native American, this race, we have more chances of developing these diseases than other ethnicity. And it's not because of who's better than who. No, it's because our DNA, our genes in our body, and had that predisposition of developing those diseases. And for example, when we're talking about diabetes, we all know what diabetes is, a condition in which our body is no longer able to metabolize the glucose in our body. And for example, you eat in the morning, you have your lunch, and you have your dinner. Every time we eat is because we feel what? We feel hungry. And if we feel hungry, every time we eat, it's the same thing as you driving your car and your car telling you that you need to go put gasoline. You put gasoline in your car, you continue your traveling, and you do diligence in your car until you see that the car needs gasoline again. In our case, we need to get gasoline, meaning eating more frequently, and that is why we're developing that pattern of breakfast, lunch, and dinner, and that is how we replenish our energy. But diabetes is a serious condition and it's a condition in which we lack the ability to produce some hormones in our body. And that hormone that we don't produce, the name of that hormone is insulin. It's made up out of our pancreas. And for some reason, for some genetic reasons, if we are African American, we are from the Pacific Island, people from Hawaii, people from Philippines, and if we are Latinos, we have the chances of more frequently developing these conditions. And when we eat we increase the glucose level, but we do not increase the amount of production of the insulin. And every time we eat, our glucose level go higher and higher and higher. And that is why then we need to enter into therapy. The therapy that usually doctor prescribe, medication. Those medication can be one, two, or three different medication for just one problem. And imagining now that you're taking three medication for one problem, but you also had hypertension, but you also had cholesterol. How many medication you're going to be taking? A lot of medications. And the medications sometimes lead to other problems because sometimes we try to cure one thing, but that one thing that is being treated might end up suffering from other things. And that is why we have to be so careful. So really, really, really so careful when we taking medication to follow doctor's advice. But when you see here, again, the glucose level, the A1C is the most frequently um, done tests right now in order for the doctor to see how your glucose level work in your body. But when you are between 4 to 6.5, you can consider that that is a normal uh, A1C. That means that your glucose more likely is always between the normal range, which is 70 to 100. But when you are 6.5 to zero point 0.9, it's meaning probably that your glucose level are moving around 100 to 150, maybe to 170 or higher. But when you had glucose level, I would say 9, 10, 11, 12, we're talking about serious number. We're talking about number about 200 or 210, 225, 230, 250, 300. And when you 12 and above, we're talking about number of 450 or more level of glucose in your blood. And when you are up there, that means that you are not producing not enough insulin to burn down your glucose in your body. And when you do not burn out the energy, it's like you're not going to fill it up your um, tank, your car, and 10 minutes later you're gonna stop in the next gas station to put more. No, it means that as long as we are alive, we're gonna keep eating, and that number of glucose is not treated. You're gonna keep higher and higher and higher, and that is the problem that now become a serious problem that can put us in a in a risk factor, and not only having problem with our heart, having problem with our kidney, having problem with our skin, having problem with our vision, having problem with our brain. Maybe we can developing uh, um, uh, what we calling these conditions that sometimes we end up in the hospital and not having consciousness of anything around us. And that is a serious problem when we end up with losing our mind, not our mind, that we end up, I don't remember the word right now, but it's a serious problem that we end up not having notion of what's going on around us. If someone knows the condition, please remind me. But also kidney and cardiovascular diseases will be the end of us not having a glucose control, because when your body do not metabolize the energy, the lack of energy that we're going to have, the lack of nutrient that we're going to be having in our body, it will be it will not care, because yes, I have gasoline, yes, I have the glucose, yes, I have a lot of energy, but not that energy is not being able to burn down because I'm not producing enough insulin. Next, Matthew. And this is the condition that we're developing that we might end up in a heart attack. Metabolic syndromes are increased by following this. You see the three veins, and we are developing, I would say, fatty tissue in the three on the right, you see that little yellowish at the bottom, and you see the blood moving around. But also at the bottom of the picture on the left, you see that now the clock is completely blocking the the circumference of the vein. And when that is blocking, it means that blood cannot pass to the other side. And when that other side do not receive nutrient, when that other side do not receive mineral, when that other side do not receive energy or oxygen, if you see on the right the picture with the heart, that at the bottom on the right had that black mark, like a dark mark there, you see that the picture in the circle, those yellowy things are what we call in cholesterol. Those yellow things there are the result of the burger, of the pork chop, of the fried food, of the fry, uh, uh, um, the bad behavior, the years of bad eating, the year of being always exposed to fatty food, or fried food, and yes, over the year we don't feel, uh, we're not afraid because nothing happened to me. But internally, yes, something happened to you, because in order for us to develop in the blockage in our around our heart, it takes time. And that is why it takes time. You don't feel nothing, because when you are, I would say, uh, in your 20, when you are in your 30, when you are in your 40, but now, by now, me in my 50, I'm now feeling that I'm tired all the time, that I cannot function well, that physical activity are very difficult to do for me. And I thinking, no, it's something else, but no, these are the conditions that we create on our own by the years of fatty food. And now that dark area in your heart is a heart attack waiting to happen. Why is a heart attack waiting to happen? Because the reason that dark area is there is because that dark area is the death of the tissue, is the death of the muscle of the heart. Why? Because that area do not receive no blood, that area do not receive nutrient, that area do not receive oxygen. And it's the same thing if you grabbing uh, you grabbing a rubber band, put it in your finger, tie it up around, and then you can keep it tied up like that. What's going to happen to the finger on this side is that your finger is going to start changing color. It's going to start feeling a pressure. And if you do it on your heart, it's the same thing that your heart goes through when you have a blockage around the veins of your heart. And that is what we're calling uh, cardiovascular diseases. In the end, the year of you, next Matthew, in the end of the year of you being exposed to that food. And this is why uh, metabolic syndrome matter. It matters because if we look throughout the year and we are more careful in what we eat, um, we're going to know that reducing your weight is a significant uh, factor for you to that you of you reducing the chances of developing those um, diseases early in life. The increasing of your physical activity, it means that you're going to have um, a better body weight, a better notion of blood circulation, a better notion of more healthy body feelings in your body, uh, eating better and eating better, heart healthy diet. It means that these pictures that you see at the bottom are for you to not just to see it. Oh, nice picture. No, what we try to tell you is on the left, the type of grain, whole grain. Anything that when you buy in the supermarket that says whole grain is better than uh, processed, highly processed food. And what is highly processed food? Let me bring one, for example, dough. Pancake dough, uh, very easily to make, but highly processed food. You see that you have a pancake done in 1 minute. It's just pour it in the pan and flip it, and then you have a meal right in front of you. Highly processed food. Now, yes, that food is there. Yes, they make it, but yes, we are the one making the decision. Because if we decide to go more for whole grain, company will be looking for to provide us with food based on whole grain. But if we don't and we go for the easy way, the easy out way, then company will be continuing doing the easy highway for us. Sometimes I telling you to go around the supermarket. When you enter, the first thing you see in supermarket sometimes are the vegetable, and you're supposed to start there. But if you keep yourself from going aisle to aisle to aisle to aisle in the supermarket, if you go only around, you're going to find everything you need. But the problem is when we go zigzagging the supermarket, just looking for something to call my attention. And yet, company will be uh, providing you items that they will look good to your eyes, and then you're going to be, oh, let me try this, let me try that, and when you end up ending with a car full of, I would say, um, uh, full of junk food, food that are not really had the value, the nutritional value that you need as a consumer. So this picture here is for you to see. You see the whole grain, you see the vegetable, you see the fish, and also the chicken. None of that thing is done fry or not. Yeah, bake, or steam it, but we need to change the way we see food this day. We're going to be presenting, Net Matthew, we're going to be presenting in 2 weeks from today. We have going to have a conversation, and that conversation will be here, and I hope that you will come to the conversation. That will be January, February 20. We're having a nurse practitioner that is very versed in heart condition. We're going to have a nutritional health educator, and we're going to have a person that going to teach us, and they're going to talk to you about heart diseases again, because I'm facing over here metabolic syndrome, but she's going to be talking directly to you about the mechanic of the heart and heart condition, and that will be fabulous. Don't forget, February 20, uh, 11 to 12, over here on Sean channel.
Yep,
Matthew,
I will be reminding them, Carlos,
yeah,
and
yeah,
they have it on their calendar, and we'll be sending them the link.
yeah. I had to send you a link today. The next one, Matthew. Um, so we all have in common this thing. In order for us to talk about our metabolic syndrome, we all have a nurse, we all have a doctor, and we all have a pharmacy. What I mean with that is that when you go to your doctor and you want to talk about this issue, may ask, don't be shy. Talk to your group of physicians, talk to your nurse. The nurse is the first line of. The doctor then come inside the exam room. And yes, sometimes you don't have a chance to talk to the doctor, but claim you 10 minutes with the doctor. The 10 minutes of your doctor is now when they put you inside a room, and 5 minutes later the doctor show up, and 5 minutes later the doctor leave the room. Claim your 10 minutes with your doctor. Write down in a piece of paper the night before or 2 weeks before, or the night before, or 2 days, or 3 days before, or the week earlier, or take a month, take a chance, and write every single day what you're feeling. And at the end, toward the end, the closest day of your medical visit, review the list. Take from that list the more important thing that you want to talk to your doctor, and sit down and claim from your doctor your 10 minutes. Because unfortunately, that is what we get when we go see the doctor. 10 minutes, 12 minutes. So claim your 10 minutes, your 12 minutes, your 15 minutes, but claim it by asking the question that you need from your doctor, because they are the one that's supposed to be evaluating your body, your medical conditions, in order for both for you at the same time being able to make medical decisions. Next, Matthew. Again, we talk about this diagnosis. Again, uh, you can right now think about, do I am uh, a person that can be considered to have a medical metabolic syndrome? Yeah, it sounds fancy word, but it's a simple thing. I have how many medical conditions I have. In those medical conditions that I have, they are out of control. Those medical conditions that I have, I'm not treating them well. The medical condition that I have, I am more aware of one and not the other, or I am putting more attention to one and not the other. But if my medical condition, I am obesity, if my weight is more than 40, if my weight as a woman is more than 35, if I have problem with controlling my triglyceride, if I am my glucose, my cholesterol are out of control. For men is less than 40, for women is less than 50. But if they are above that, what do I doing? What is my blood pressure? My blood pressure is out of control. I am always around 130 to 80, around 85 or higher. If I am around 150 over 1 over 90, those are uncontrollable high blood pressures, and they need to be bring down. And the way we bring down hypertension or high blood pressure is by following doctor's advice. I might have to take my medication, and medication for hypertension are medication for life. That doesn't mean that I will be taking medication all my life, because maybe at some point I control my blood pressure and my doctor tell me, oh, stop the medication for hypertension, or the doctor might tell you, you don't need to take uh, the 3 pills that you are taking for hypertension. We're gonna give you now. We're gonna give you this one pill, and that's progress when we get to those levels. But you can say if you are or you having problem with metabolic syndrome right now by just reviewing, by just you thinking about the conversation that you have with your doctor, by you just thinking what kind of medication I am taking, if I am overweight, if I am uh, having more than 40 on my weight, or 35 women in the women, if I have uh, hypertension, or I had diabetes, or I am overweight. So those are medical conditions. But if 3 or more apply to you, consider now that it's time for you to make decision. Next, Matthew. Preventive treatment, again, between you, between your doctors, nurses, and pharmacy. And you might think, why Carlo mentioning pharmacy? Is the one that making decisions are doctors and nurses. Pharmacy because you need medication. Pharmacy because you need to know what's the side effect of the medications um, are. So again, think about that. And any kind of medication we take might have side effect. And we need to know if I can take it together with other medication or if I had to take it separate, if I had to wait 1 or 2 hours between medication. What does medication going to do in my stomach? A lot of people complain about side effect, and most of the side effect usually had to deal with upset stomach after you taking it. But most of the time it's because of the way we're taking the medication. Sometimes the medication had to go with water, or sometimes the medication had to go with some food in my stomach, or sometimes the medication are not to taking in the morning but at night. And we sometimes get so confused that we go all over the place with our medications. So be careful. Next, Matthew. And preventing. Prevention uh, is simple. Take charge of your medical decision. Take charge of your medical condition. The doctor might address you uh, through through the thought or through the lifestyle changes. And lifestyle changes are the same thing that you have done all your life. All your life, you didn't change anything about the thing that you used to do when it comes to food, when it comes to healthy food, when it comes to physical activity. You didn't do nothing because you was not aware of your medical condition the way that you are aware after the presentation. I know people that in the long run they listen to this type of conversation from the first time and then they go and they right away say to themselves, I had to do changes. I'm going to do changes. And those lifestyle changes are not something that we ask you to do from one day to the other. I'm not telling you to cut up right away the way you do things. But yes, we can tell you that if you do changes and you do changes in your diet, you do changes in your exercise, you do changes in your lifestyle, the thing that you're going to do things, the first thing that you're going to be noticing is that you are what? Losing weight. It's no matter of you putting in your head that I'm going to lose 10 pounds the first week. No, we don't want you to think like that. But we do want you to make changes, and those changes, in the end result of those changes, you're going to be seeing then in the long, let's say in the first 3 months of you looking to make changes. Why these changes have to come this way? Because if you do something drastically, in the end, what you end up is not basically helping yourself. It's not basically allowing yourself because what the in the end you're going to be losing 10 pounds in less than 1 month, but at the end of the month you're going to go back to the thing that you usually do, which is not care about the way you look, not care about the way you eat. So we need to be more aware of that, my people. Healthy eating is something that if you do it every day, you're going to see results within your weight loss. And, and that is something simple. The length that is going to take you is what matter. You will want to lose 1 week and you want to lose one week. You want to lose 10 pounds, thinking that in 3 months you're going to be looking for to lose 10 pounds in the next 3 months. So make the right decision, healthy eating, more exercises, healthy eating, more exercises, healthy eating, more exercises. The right amount of food in your plate is going to take you Your breakfast at the same time, your lunch and your dinner had to be around, always thinking on healthy eating. Next, Matthew. Uh, Lifestyle changes. Um, is simple. Look on the thing that you can do. Make a plan. In that plan, you have to target the food and describe to yourself what was that I was eating in the last 3 years, what I was eating in the last 2 years, what I was eating in the last year, what I was eating 6 months ago, or what do I ate yesterday. As simple as that. And take charge and look for a bite. Look for information. Everybody has a phone, but check your life. Sit down and think, what can I do better? And now, when you identify a problem, make a deal with yourself. Let me change that. Now think how I'm going to change it. And think how people around you are going to help you changing those behaviors. In order for you to do better, start one day. Take a day to start. Maybe not today, maybe not tomorrow. Um, but pick a day. We're going to have better weather. I would say in 3 or 4 weeks, we're going to be seeing better weather, warmer weather. Start with that weather. No, don't wait until the summer because the summer heat might not going to tell you or might not going it was discourage you to do things. But you still now with the weather, by when the heat comes, it will be easy for you to go out. Eat better, get more active, and you will lose weight. Next, Matthew. And lifestyle changing will help you manage your blood pressure. You will be able to control better your cholesterol because you're going to be eating more healthy food that are not high in cholesterol, or food that are not uh, going to increase but decrease your cholesterol. And when people have high uh, level of food that are very high in fiber, that allow and help you to lose cholesterol. So look for when you look and when you read the label in the products that you buy, and you look at the label in the product that you buy, you're going to be seeing that the label going to tell you everything that is there, that is in that item. If they have a lot of high cholesterol products inside, or they are very low, or if they are high in fiber. Because the higher fiber usually help you to control better cholesterol in your body. Reduce the amount of food that you eat that are based on carbohydrate, and especially those that are in a highly processed carbohydrate. And you might ask yourself, what is carbohydrate? But carbohydrate is any food that is made up of flour or dough, pizza, white bread. Uh, when we go to the cookie jar, when you go to the sweet cookie jar of the Ritz, and when you go to buy a lot of um, food, donut, um, cake, cupcake, all of those products that are based on dough, and that dough is completely white in color, and then that is a highly processed product that will not going to give you the nutrient or the necessary amount of nutrient that you need. We have another presentation that we call in healthy eating, in which we describe more to detail everything that is out there that is food that we're supposed to be more aware uh, of the damage that that kind of food usually do to your body. Be more active. It's imperative. We're asking you to do more, at least more likely 150 minutes of physical activity, not every day, but in the week. Figure it out. How I'm going to do 150 minutes of physical activity within a week? Is maybe that you will be able to divide it 150 into seven day, or you can say, but the amount of minutes that I'm going to get is not much. It's going to be maybe around uh, 15 or 18 minutes of exercise, and that's not basically nothing. But if you figure it out that 150 minutes and you say that I'm going to do, let's say, 30 minutes most of the days of the week, that become like 3 or 4 days of the week that you're going to be doing that exercise, 30 minutes. I tell you, I'm going to tell you one thing. If you do 30 minutes of exercise, the most easy exercise out there is walking. If you can, and you don't have no physical impediment, hop on the street, hop on the sidewalk, hop on the treadmill, and do your 30 minutes of exercise every day. And you will see end result at the end of the month. You're going to be seeing end result at the end of the 3 months, maybe 10, maybe 7. But if you make a deal with yourself and you weigh yourself and you are 100, 200 pounds and you want to lose 7.5% of your initial weight, what I am telling you is that you only had to lose um, 14 pounds in the first year. And it's something possible to do by doing 30 minutes of exercise every day or most of the days of the week. And bad habit. If you drink, you smoke. If you smoke, it's a no-no. But if you drink and you're reducing the amount, or you see the amount of calories that you intake every time you drink a pack of beer, you might going to be reducing that pack of beer that you drink every week on a basically week basis, and you might drink and you might will reduce it to maybe 2, 3 beer now, or you might be able to quit. It would be even better. But smoke, the use of illicit drugs, those are not no good thing for your body and especially for your heart.